My name is Shruthi Saravanan, and this semester I interned under Dr. Lara Hart at Roswell OB GYN. My internship took place in mainly 3 different locations: the Northside Forsyth Hospital, the Alpharetta Clinic, and Northside Sandy Springs Women's Center. My internship site has been very much like a shadowing position. Usually, my duties and responsibilities are limited to following my site supervisor, Dr. Hart, as she charts, diagnoses, and visits patients. I observe Dr. Hart's interactions with her patients and gain knowledge on various gynecological and obstetric procedures and conditions. I take notes on the subject matter of the patient's visit, and we discuss it later. Dr. Hart sometimes asks me to research a certain topic, and I come back in the next day prepared to discuss and explain my findings. My most exciting day was at Northside Women's Care Center. There, I was able to go through an entire day by Dr. Hart's site and was able to do many things unavailable at the clinic. I would say that this was my greatest experience because I was able to witness childbirth on my very first day. Over the course of my internship, I've had the opportunity to do so many things I wouldn't normally be able to do. I've been in many ORs. I've learned about analyzing heart rates and contraction rates, viewed outpatient rooms and procedures, and I've spent time talking to midwives and nurses on the L&D floors. Something I have learned about my career field that I did not expect is how big of an impact having social skills is in working in the clinical setting. The ability to read people, to listen carefully, to improvise effectively, and to teach and tell a compelling story, they are all skills very essential to the job. Additionally, it is very surprising to see how little people in other fields of medicine know about proper management of patients within another field. There is a lot of consulting done within the medical field as everyone specializes and does the job they know best. Additionally, boring medicine is in fact good medicine. When cases become quote-unquote exciting, it usually ends badly for the patient. Good medicine is seeing the patient early and recognizing the signs of impending doom while they are still nice and stable. Nurses and nurse practitioners are also on hand to see patients and take vitals and blood work. Days where an OB/GYN is on call, she remains ready to attend to urgent matters at the hospital, such as emergency C-sections. Most of the time, the doctors have on-call rooms at the hospital in which they can sleep, relax, and work while remaining on call. As far as new insights I have gained about myself in this internship experience, I have realized that practicing medicine requires a lot of patience and a lot of tolerance. Interning here has also let me really evaluate the amount of time it takes to become a doctor and become settled, and consider other medical career alternatives after being exposed to these other professionals in the workplace environment. I think that the best thing about this career is that every day one gets the chance to impact and help someone's life directly. Unlike other doctors, OB/GYNs treat not only 1, but 2 patients at the same time. This can complicate things a lot. Overseeing something as intrinsic to human life as the start of life itself is no easy task, but the satisfaction of successfully doing so knows no bounds. On the other hand, I feel that the worst thing about this career are its liabilities. You always run a risk of making the wrong choice and directly affecting your patients and/or their child's health. Also, a lot of the times, there are a lot of medical conditions and patients we are unable to cure, but rather just patch up and move along. While it is expected that people come to you with a problem and you give them a solution and they walk out relieved, in reality, that's not the case for most specialties or patients. In that sense, this career is a very high-stress, high-risk job. It very much epitomizes the saying, "With great power comes great responsibility." But as with every career, every day is different, and there's always something new to learn if you are willing to look for it and ask the right questions.